I was just um, over there at my Instagram doing the exact same broadcast over there. And I told them that I'm going to come over here and do the same thing over here. But see, on here, it's a lot different. I have more of a viewership here than I do on my Instagram, which I hopefully one day will change, because I think that this disease and what it's all about is really important. You guys, give me a second. I'm gonna try to. There we go. Okay. Oh. There we go. I believe that this disease is very important, and I don't think we should look at it lightly. Well, okay, here we go. I was, asked a few questions about this disease and how it affects me. Because let's face it, everywhere you go, as far as looking for this disease and how it affects people, everywhere you go, it's always you're looking at. But there you go. My neck is really, really hurting, guys. Everywhere you go, even on these .org websites, you want to look at stories and how they affect certain people. When you do that, you want to look for people that look like you, because even in the back of our minds, we feel like our symptoms are going to be different than anybody else because we are of a different race. Well, I'm here to tell you that is absolutely true. Okay, when I go on these .org websites and I'm looking for people with scleroderma, I'm trying to find the people that look like me, African American, black, and it's very hard to find those. You may find maybe one or two people that are African American on there, and I'm like, wait, do they believe that we get the disease too? But see, it's contradicting, because even though you don't see, people, African American people on there going over their scleroderma stories, you do, however, have information in one of their articles stating that we have a higher mortality rate, as far as African Americans have a higher mortality rate with this disease than any other race, and that our manifestations are a lot different than any other race. And I believe it's due to some type of genetic makeup. So I'm like, okay, if that's the case, then why is it that you don't see a lot of African Americans on here telling their stories? You see a lot of Caucasian Americans, you see a lot of Arab Americans, you see different types of people and races, but you don't see African a lot, like not even a lot, but maybe say equal amount of African American people with scleroderma. Now, I'm not trying to make a race thing here. What I'm saying is, if this disease affects us as much or even more than any other race, then I think that our stories need to be heard. So, and the reason why I'm driving that home is because I am getting questions from people with scleroderma that happen to be African American asking me, because my face is out there with this disease, and they're like, wait a minute, you have it? And let me tell you something, it's deeper than what I'm saying, because I've been to doctors, and before I was diagnosed, I've been to doctors trying to figure out what is this that's progressively killing me and attacking my organs and making everything weird, and they couldn't pinpoint it. And they tested me for everything but scleroderma. Like, that's something that's out of the question. The only reason why I pushed for it, because my pulmonologist thought that I could have it on a serum level, like as far as what my results say, and him going all the way back in my medical history and saying, hey, wait a minute, this pointing towards scleroderma. And when he told me that, I'm like, what is scleroderma? And that threw me back, because I'm like, what is that? And he went to explain what the disease was, and I'm like, really? So when he told me about that, that's what made me advocate more and more to these doctors. Like, hey, let's run these tests, let's rule this out because I don't want it. I don't want this disease. I heard about it. I have no passion to want this. Like, let's rule this out. So they ran tests, they did blood tests, they tested me for the scleroderma blood marker, and it came up negative. And they said, well, you don't have it. I'm like, well, something's attacking to my organ. Something is messing with it. They said, well, it's the lupus. I said, I don't know, because with every medical report, I'm seeing sclerosis in it. The word sclerosis or hardening. I didn't know that lupus can harden organs. So they was like, well, lupus has come a long way. Like lupus is like some kind of forthcoming or something. Like it's come a long way. Like, really? It's come a long way? Okay, whatever. So one day, this is how I found out. One day I got sick and I went to the ER and they ran some blood tests and they admitted me to the hospital. Overnight, I got rest. The next day, they performed an endoscopy, which is for the for the esophagus, the stomach, and some of the intestines. And they want to see that way what's going on because, again, my gastro and my GI tract is really screwed up and no one could ever tell me why. So I've been dealing with this for like 4 years and no one can tell me why. So this hospital did this, and while I was here, and they, put me on. Before they put me under, they told me that they're going to do this procedure. I'm going to be put under general anesthesia, and if they see anything abnormal, they're going to do a biopsy. And I'm like, you know what? I don't think you're going to see anything abnormal because these doctors are claiming I don't have anything, so I don't think you're going to find anything. So they said, well, we're going to see. So guess what? They found something abnormal in there. And the doctor told me when I came to that they did find something abnormal and was concerning me, and they did a biopsy. And I'm like, okay. But they didn't want to say. I said, well, what did you find? What disease? Did you know it? They said, well, we're not going to say anything until we get all the results back. Meaning all the x-rays, all the CAT scans, all the biopsy, what they found on the endoscopy, what they saw in my stomach, what they saw all inside my body. I said, okay. So I'm thinking I'm going to get these results and diagnosis way before I left, but no. So I went home, I was discharged, and they said that they're going to update me with any diagnosis, any new diagnosis or any blood results and everything once they get all the tests in. So they got all the tests in, and they told me I had systemic sclerosis, which is diffuse systemic scleroderma. And that's when my heart dropped. Because according to these doctors, black people don't get it. And to this day, they still think I don't have it. Even though there is a procedure that was done to solve inside of my stomach. And that's where they saw it. They found this scleroderma and all up in there. And with my esophagus and everything else, they found it like wreaking havoc and affecting my heart and affecting my kidneys, and they still want to look at my nails. Every time I go to rheumatologist people, you know what they do? They look at my nails. Like, I'm like, are you giving me a pedicure? I didn't even get to pick a color yet. So what's going on? So I did a little research of my own. And I went to the Scleroderma Foundation's website, and I read something. And it said that black people who get this disease, their manifestations and how they carry this disease are different than any other race, and that we have a higher mortality rate than any other race, and that this disease is more progressive in African Americans than any other race. Yeah, you guys, I'm serious. When I saw that, I was like floored. I'm like, okay, this is why my organs are being affected in this fast rate? Yes. Then I said, you know what, maybe I'm reading something wrong. So I spoke to someone that's over the Florida chapter, and I also spoke to the national office for the Scleroderma Foundation, and I wanted to get more information on what I read. and they confirmed it. When I told them my experiences with these doctors, and they said, well, no, you're not going to carry the disease the same way. Everybody carries the disease differently. Doesn't mean that you don't have it. That means that your manifestations are different. And because you're African American and you have a different genetic makeup than any other race, it's going to affect you differently. So while these doctors are looking for the hard skin and they're looking for the weight loss and they're looking for the same, like this, your lips, that get thin, because with the scleroderma, your lips do get thin. And they're looking for all this, and I'm not presenting that. They just automatically throw scleroderma out the window, although the hospital did find it. And when I told the Scleroderma Foundation about that, they said, you know what? The procedure you have done is the most accurate procedure to diagnose scleroderma in any blood test. So for them to discount that is wrong. And they suggested that I see a scleroderma specialist, but then again, there are not a lot of them. Number one, in my plan, and number two, in the state of Florida. And I don't have time to fly to another state to see a scleroderma specialist. So pretty much, guys, I'm screwed. But I did want to bring that information to you that, I get questions from African American people that had family members that had scleroderma, and it wasn't taken seriously, and because of that, their loved ones died. I knew of a girl who had scleroderma, and she passed away a year and a half ago, and she was a little bigger than I was. And she didn't have the manifestations of everybody else, and it claimed her life. And she was a little younger than I am. So, if you're an African American person with this disease, please believe that you're not going to have the same manifestations as, Caucasian Americans. Sorry, you still have the disease, but you won't have the same manifestations as they do. So don't look to have the same, symptoms and the same, manifestations as they do. Example, my manifestations are very minimal because it's attacking me on the inside level. It's barely touching the outside part. But I do see small things that indicate I have it. Like, for example, doctors like to speak Raynaud's. And what Raynaud's phenomenon is, if your hands are subjected to cold, and lupus patients go through this too. When your hands are subjected to cold, your fingertips will turn white, then blue, and then red. And this is a very painful thing. With African Americans, we do get the white manifestation. We hardly get the blue or the red when we get the same pain as anybody else. And that's because of the melanin in our skin. It doesn't present outward like anyone else does. So that's number one. So if you have it and you touch something like a can of soda and your hands are hurting, your fingers are hurting, like it's so painful. It kind of feels like when you're at the 4th of July and you want to get that really cold soda at the bottom of the, what you call that thing? Woo! Burn heart. Oh my God. Cooler. There you go. You want to get that good cold soda or juice or water at the bottom of it because you feel like the bottom, that's where all the cold drinks are, and you put your hands in there and by golly you snatch it back out because it hurts so bad. We get that pain by grabbing a regular cold can of soda. It doesn't even have to be at the bottom of a cooler. We can put our hand in the fridge and it'll happen. Or it can be cold outside and our hands can turn that way. So if you're having that manifestation, then you have Raynaud's, okay? Now, I do have minor skin manifestations, and most of it is on my feet. And because I'm African American, that's where the skin manifestations happen the most. On my feet, my hands, my feet, hands, and face, or something like that. So it's really happening on my feet. I have dark spots, dark patches and things on my feet. I have a lot of pain in my feet. I have pain in my feet whether I'm walking or standing. I could be sitting and I have pain in my feet. I have really bad joint pain, muscle pain, bone pain in my hands. The scleroderma is making it hard for me to hold things. It's making it hard for me to grasp things and hold on to them or squeeze things. Really, really painful for me to do that. You know, even with my arms, you know, when I have to hold my arms out for IVs or, you know, when they want to do my blood pressure and they tell you to put your arm out, that's painful. Holding my arm up like that, very, very painful. So, yes, I do get manifestations of scleroderma, but not the same as everybody else, okay? Also, I started to get dents in my muscles. You know how you want to say it? At this, you could feel it if you were to be like right where I'm at. Right here, my fingers going up and down, there is a line, like a straight line, but it's a dent in the middle of my head. Never had that in my head before, ever. I have it also on my upper arm. I have the same lines, I think, if I feel, sometimes I can hit where the dents are. Sometimes I can't. It depends on what day of time it is. Oh, right in here. I have the same, like lines with the dents. So, it affects us different. It affects black people different. Sorry. So when you got people out there saying that we should be like everybody else, I'm sorry, but no. We should not be like everybody else. It's not possible. So please, guys, research, read. You can get this information from the Scleroderma Foundation's website. There's also a organization which I'm going to look into called GRASP, and that's GRASP. I'm going to look into them because what they're doing is researching scleroderma in black people on a genetic level and trying to come up with reasons on why ours are different, but more deadly. So they're trying to bridge that gap and wondering why is that. So I'm going to do some research into GRASP as well and get back to you with that. But other than that, I'm doing pretty well. And you know, things like that. You know, I wish my channel will reach more people, but it's not going to stop me from doing what I'm doing. But it's just that I wish I could reach more people and spread that awareness out there, because I believe that a lot of African American people are not doing the right thing and being, you know, going to the doctor and getting these things checked out. I don't think they're causing alarm to it. They're not ringing any bells. They're not looking into it or caring enough to get this checked out. You know, if they have a cold that lasts more than 3 weeks, they just blow it off as, oh, it's just a long cold. I'm sorry. That's not something that's normal. You need to check that out. And because we are stubborn people, we don't want to look into it, or it could be a mindset we picked up when we were born that, you know, if something happens, you can get it over the counter, or you just get over it, or it's just something normal that you just deal with. Well, I'm sorry, but we lose a lot of our loved ones and our family members because we're not doing our due diligence and, you know, getting the proper checkup. You know, we're not going to the doctor as normally as we should. We're not doing that. We're just chilling, you know. And I don't think that's the right thing to do. You know, I just don't. We care more about shaking our ass or going to the club than to see if we have any type of autoimmune disease or see if we even have cancer. Dude, we don't even get checked out for that. You know, we don't want to deal with the testing. We don't want to hear it. But you know what? Maybe you need to hear it. You know, maybe it's better if you get it detected early than to sit on your butt and not do anything about it. You know, you just need to go out there and get it. You think I like hearing that I got this crap and it's going to kill me? Hell no. But you know what? I fought and I clawed and I screamed at the top of my lungs until they listened to me. And now that they listen to me, now I know what I have, and I'm thankful for that. So that now I can get into some treatment and get this thing prolonged. No, I can't stop it, and it cannot be stopped, but it can be prolonged. You know what I mean? So as African American people, we need to stop being stupid and ignorant and look at our health, because we care about everything else but our health. We don't give a crap about our health. And then when we find out we have something, it's, oh, well, it's me. You know what I mean? You don't get checked out. You don't do this. I don't see anything on YouTube that's saying, oh, black people, go get checked out. You know, I think you should. You know, I think you should get out there and get checked out. Get your blood work done. Get checked out. Open your mouth and say, hey, check me for this. I have a family background of this. Please check me for that. You know, when you give them your medical history, they say, well, who has this in your family? If you happen to say somebody does, you know, these doctors are not going to test you for it. They're just going to just write it down and that's it. No, you say, wait a minute. I want to be tested because I don't want to have this. Just test me for it. Rule it out. They're not going to do it. You have to tell them that you want checked. And a lot of us are not doing that. We're just giving the information and we're not following up on it. You know, we rather get up on here and try to talk about people and ruin people. Why don't we try to better each other? And what I'm doing is bringing scleroderma and making it a name. What the hell that means? When the doctor told me I had it, I'm like, sclera? What? What is a sclera? What? I want people to stop saying that. Sclera what? Sclera who? What is sclera what? I want people, when people say scleroderma, I want people to say, oh, no, let's do these tests and see if I don't have this. Oh, we suspect sclera. No, we don't want to suspect no sclera, nothing. Let's go ahead and get these tested and be done with it. Not sclera what? Huh? What? Now, when we hear lupus and MS, we know what that is. Because I have lupus too. So, but when people say scleroderma, it's like, huh? No more hum. Let's stop with the hum. Let's make it a, I don't want that. No. I don't want that. Because let me tell you something. This is bad disease, trust me, I have it. But still, it ain't got nothing on scleroderma. Nothing. You hear me? Scleroderma is like the big bitch in the classroom. You know it's a bitch, and it like to destroy stuff. And when it destroys stuff, it'll sit there and clap because it did. It's one of them people that'll laugh at your pain and keep hurting you until you're dead. That's scleroderma. It gives a meaning of hard skin. It's not just hard skin, people. It's hard heart, hard kidneys, hard lungs, hard everything, hard. It just wreaks havoc inside your body. Like, screw this, screw this, screw this, screw this. It's like having a checklist on what organ is going to mess with that day. It's a serious disease, and we need to call attention to it. It shouldn't be sclera who. I go through Facebook, and I see nothing but lupus, nothing but MS, but nobody want to mention scleroderma, which is like the most effed up freaking autoimmune disease there is. Sorry, I ain't trying to make scleroderma big daddy, but you know what it is? You know what that means? Hard organs, meaning your kidney can turn like stone. You know what happens when something turns to stone? It dies. It's dead already. It can mess with you so much to where it'll shut all your organs down and turn them hard. And guess what? If you don't have any organs that's soft and can provide the nutrients for your body, you're going to die on the spot. Once that organ gets hard, or even a piece of it gets hard, that's it. There's no medicine to soften it. There's nothing you can do but get a transplant. And those things are hard to come by. It's no outcry. It's no... Man, you guys gotta understand. This is killing people. People. You can have scleroderma right now, don't know it. Because you're not getting checked up. You're not getting them tests. I think every person in America needs to get their autoimmune test. That's what I think. If more people get tested and there's a more outcome of people with it, the more awareness we can bring to all the autoimmune diseases. And the more we can bring awareness to it, the more of a possibility for a faster cure will it be. That's what I believe. The more awareness we bring, the faster track to a cure we will get. That's what I'm saying. Because right now there's no cure. There's treatment for any other disease, but there's no treatment for scleroderma. The only thing you can do is take diseases to slow down the progression of your organs failing. And I mean, it's a minimal slowdown because this disease moves in like a thief in the night. It ain't gonna stop till you get all your valuables. You know what I mean? So, bruh, I said, I already know my outcome. It is what it is. What I'm trying to do is bring more awareness so other people won't suffer. It's bad. I'm not gonna say they won't suffer and say suffer is bad. And we can get there early and have a more positive outcome. You know, even though this disease is more progressive in black people, we at least want to know and find out early so it won't. I can't say that because I just can't say it. There is no slow progression or not in my case. It's really messing with me in a real good way. It's scary. The only thing I can do is continue to do this and bring awareness to it and try to get my face out there and this awareness out there as much as I can, so that I'm gonna, make it to where people are going to get tested and take it seriously. That's what it should be. This is not for fame, man. This is to save lives or prolong them. This is it. I'm here to save people. I can't do it physically. I have to find a way to save people. And this is how I'm going to do it. This is the reason why I do this. I mean, come on. This disease put me in a wheelchair, people. This disease really lowered my quality of life. It really did. Now I may look good right now. I'm a goddess and everything. I can understand that. But this disease did do its work, and it's continuing to work hard on my body like a construction site. Don't know what it's trying to find, but it's definitely doing some damage. And it definitely has me in a wheelchair, right? Like, rolling like I don't know what. It is what it is. It has me on oxygen. Continuously. For the rest of my damn life. Because of the disease that scleroderma brought along, it brought a friend with it. It brought a friend. Scleroderma like to bring invited guests into the house. They like to bring their peeps and their entourage all up in your body. And for some reason, scleroderma decided to bring their friend called pulmonary arterial hypertension all up into the mix. And that little bastard loved to fuck shit up and make you not want to breathe right and make your chest hurt and make your carotid arteries blow up like mine is and kill you possibly. It's like scleroderma sidekick. Pulmonary arterial hypertension. Bad house guests. Because scleroderma love them because they're a tag team. Oh yeah. I think they go hand in hand. Can't have the scleroderma without the pH. That's like an unwanted cockroach on the TV. That little irritating little roaches. You got roaches? Come on, everybody had roaches. You got company? You watching TV? Next thing you know, a little cockroach is going across somebody's face. And all you can do is sit there and pretend like your company and see that roach just went across your TV. That's what scleroderma does when it brings in pulmonary hypertension. They pretend like pulmonary hypertension is being seen by the heart and the lungs and everything else, but it's there. And It's there, but nobody want to call attention to it. But it does damage. Let's look at it that way. So what I'm gonna do is I'm gonna leave it here, and that's it. I just thought that it was very important for me to do that. So on that note, thank you guys for watching, and I'll see you on the flip side.